Welcome back, everyone, to Psychology 3402, Criminal Behavior. We're in Module 10, Female Offenders. In this section, we're going to be speaking about issues germane to treatment of female offenders. There's lots I could tell you, but I just want to focus on a few key things. The first thing is I want to talk about what gender-responsive or feminist-inspired scholars have criticized that dominant gender-neutral risk-needs responsivity model. Okay, so we're going to talk about those criticisms. Next, we're going to talk about what actually does gender responsive mean. I've alluded to it a little bit in our last section on risk assessment, but I want to talk a little bit about it in more concrete terms in the context of treatment. Then, of course, we're going to ultimately try to answer the question, what model is best for female offenders? Does that risk needs responsivity model work? Is it good enough? Or do we need a different approach, classified as gender responsive or feminist inspired? Which one actually works best with female offenders? So those are our three big questions in this section. Criticisms. There have been several criticisms levied against the R&R, risk needs responsivity model. Dr. Blanchette and I, we summarized these criticisms back in 2006, but a number of them still stand today. Cognitive behaviorism. I guess fundamentally, when you're reading the work written by feminist criminologists, they take huge issue with cognitive behaviorism. The notion that you can fix, or that girls and women in the criminal justice system, that their thoughts need to be fixed somehow. Fundamentally, that's wrong, according to gender responsive or feminist critical criminologists. They argue that cognitive behaviorism, this focus on individual thoughts and patterns, is just wrong because it's wrong to decontextualize women from their environments, and it's wrong to individualize them. So fundamentally, a number of criminology-oriented scholars are very, they're anti-psychology, right? This notion that you can fix individuals is wrong. Why? Because fundamentally, I think the critical criminologists, they want a more systemic approach, right? Deal with patriarchy, deal with sexism, deal with issues at a macro level as opposed to a micro level. So cognitive behaviorism is bad. Secondly, what they don't like about R&R, responsivity principle in particular, is that it's empirically derived, specifically using meta-analysis. So feminist criminologists are not fond of meta-analysis, specifically in the realm of understanding girls and women. Why? Because meta-analysis is all about large numbers. What do we know about the research that's predominantly been done with girls and women? Typically, small samples are used, right? Qualitative work. You don't need hundreds and hundreds of participants. You need, you could do a good qualitative study with 5 or 10 or 20. Those qualitative studies are not conducive to meta-analytic review. So, the feminist criminologists are like, this meta-analytic technique that the R&R folk keep talking about, it's really not relevant to our area of study and the way we understand phenomena. Another criticism is that R&R at the end of the day was developed by white middle-class men, so how do they know anything about women, in particular women of color? The fourth criticism is linked to the first one, this notion that cognitive behaviorism dehumanizes women, all right? So fundamentally, the critics of R&R working from a feminist background they're not fond of cognitive behaviorism because it dehumanizes, individualizes, pathologizes, and decontextualizes women from their environment. And lastly, it's not so much the feminist criminologists, but some other critics of R&R, they just say, that model, it's too simple. It just doesn't have the conceptual resources, if you will, to deal with the complexity of the lives of girls and women embroiled in the criminal justice system. So I just want to give you, that's a little heavy, it's a little up there in the clouds, but it's important to understand that some pretty strong criticisms have been levied against R&R coming from feminist criminologists. Now, there's a group of researchers, some inspired by feminist criminologists, some not. Some are psychologists or sociologists who want to develop practical strategies for dealing with girls and women in the criminal justice system. These group of researchers, we call them gender responsive researchers, GR, for lack of a better term. 3 key approaches to gender responsive treatment, all right, versus R&R treatment. First is this notion that interventions for girls and women in the correctional justice system need to be holistic. What does that mean? You can't divorce criminogenic and non-criminogenic factors. They have to be dealt with simultaneously. If somebody has an addictions problem, a woman has an addictions problem, the odds are she's probably suffering from anxiety and depression, and she probably can't get motivated to come to treatment or isn't interested in coming to treatment because she's too stressed dealing with custody issues related to her children. Gender responsive researchers say, you know what, you just can't focus on dealing with the addiction, that criminogenic need. You've got to consider the woman in her whole context and address all factors simultaneously. Even if some of those factors are best thought of as non-criminogenic variables or responsivity variables, you can't put things in silos. They have to be dealt with all together. Most gender responsive scholars still advocate skill-based treatment programs, enhancing self-efficacy, dealing and developing relapse prevention strategies, and so forth. The whole point, though, is that approaches have to be holistic, targeting both criminogenic and non-criminogenic needs together. Other key element of gender responsive models is a greater emphasis is placed on responsivity. Historically, the R&R model, there's been lots of research on the R and the N, but not as much research on the R. When Andrews and Bonta originally developed R&R, or the responsivity concept, it was quite broad, right? It was supposed to capture any factor that impedes or facilitates treatment progress. Not a lot of research has been done on responsivity in the early days. That's changing now. Gender responsive scholars in particular talk a lot about programs needing to be trauma-informed, relational, running group programs with females only versus mixed gender samples. Strengths is the big part of gender responsive treatment programs. Dealing with other gender responsive responsivity factors such as parental stress, empowering women through the process of treatment, and dealing, of course, with safety issues. And lastly, the third main component of what makes something gender responsive is that gender responsive scholars, they focus on multiple outcomes. R&R folk are very utilitarian, focused on the bottom line, if you will. Does this program reduce recidivism? Does it save money? Reductions in recidivism are important to gender responsive scholars, but gender responsive scholars are also a little broader in their outcomes. They're interested in, does this program restore women to their whole selves, restore healthy relationships, help them reintegrate in general? So what works? What do we know? What about that R&R model we've talked so much about? What about the gender responsive model? What do we know? Fortunately, Gobet, Blanchet, and Stewart conducted a recent meta-analysis. They had 37 different treatment outcome studies with women or predominantly women offenders, totaling 22,000 women participants in their meta-analysis. So summarizing the results, aggregating the results across all these 37 different treatment outcome studies, we learned that odds of recidivating were 22 to 35% less likely for women who participated in correctional treatment versus those who did not. Those results are very comparable to what we see in the male literature when we're trying to assess treatment outcomes with men. However, what this meta-analysis found was that the results, the reductions in recidivism, were the same irrespective of whether or not a treatment program was classified as gender responsive or whether it was classified as gender neutral, i.e. cognitive behavioral. Okay, so the researchers, they make lots of decisions about classifying programs into one of those two bins. Overall treatment works, it reduces recidivism for women. However, it didn't matter whether the women were in a cognitive behavioral gender neutral program or whether they were in a gender responsive program. However, the researchers dug a little deeper and they found a moderator. What was it? Methodological rigor. When they did the analysis based solely on studies classified as being really sound scientifically in terms of how well they were conducted, those pool of studies showed that it was the gender-responsive programming that outperformed the gender-neutral programming. So something's going on there with methodological rigor. One caveat, though, I want to make is that several of those gender-responsive programs, they weren't pure gender-responsive programs in the sense that they just didn't target hypothesized female-specific factors, but they did also incorporate some of the gender-neutral stuff as well. So more often than not, the gender-responsive programs were targeting addiction, substance abuse, and they were incorporating elements of cognitive behaviorism, but they were just administering the programs in a gender-responsive way. Perhaps they were trauma-informed, empowerment-based. Regardless, those gender-responsive programs had many elements, had some elements that straddled the gender-neutral paradigm, as well as those that straddle the gender-responsive paradigm. So, what's the message? The evidence supports an integrated approach, right? An approach that borrows from gender-responsive perspectives as well as gender-neutral or the R&R perspective, rather than this either-or strategy. In closing, I just want to highlight in this field we've made lots of progress in the last 10 or 20 years. There's still lots of debate for sure. And I think I would be safe in saying that most gender-responsive scholars support that risk principle, as well as specific responsivity principle, right? This notion that there are things about a person that we have to take into consideration when we're delivering treatment in order to maximize our treatment outcomes. However, a number of gender-responsive scholars haven't bought into cognitive behaviorism is the only way to change and rehabilitate women. Some gender-responsive scholars are okay incorporating gender or cognitive behavioral practices into their programs, provided that they're delivered in a relational way. I would have to say that the big remaining debate in this area is what are the need factors that should be targeted for women offenders? What are the risk and need factors, right? Gender-responsive scholars put a lot of emphasis on relational dysfunction, addictions, abuse, trauma, mental health, the need to empower women. Whereas those things aren't, with the exception of addictions, those other factors aren't really big on the radar. They're not part of the big four in the gender-neutral world, right? Gender-neutral scholars, in terms of dynamic things, the two big dynamic factors that can change a lot, criminal attitudes and criminal associates, those are the two biggies in the gender-neutral world. And ironically, in the gender-responsive world, those two factors don't really pop up that much. Criminal associates per se does, but really only in the context of intimate partner relationships. So, still lots of work to happen in the area of what needs are really relevant for girls and women in the criminal justice system, but nonetheless we have made lots of progress, particularly in our agreement regarding the importance of risk and responsivity principles with women and girls. Thank you.